Hey, Dr. Ferguson coming to you from the Passion Cam. We've been talking about Alzheimer's disease over the last several sessions here. Going to continue to do that. A lot of people hear the word dementia, hear the word Alzheimer's disease, and they don't really know what the difference is. Well, what is the difference? Dementia is the big umbrella word. So if you had an umbrella, let's use a cake for example. Say you had a cake. Dementia is the whole cake. Alzheimer's disease is 65% of the cake. Parkinson's disease might be another 10 to 15% of the cake. Multi-infarct dementia, another portion of the cake. Huntington's chorea, another portion of the cake, etc. So, and then the number gets smaller and smaller. But you can see that Alzheimer's disease is the biggest portion of dementia that we see. And they're not all the same by any shape, form, or fashion, but towards the end, they all look the same. So if you get dementia and it's secondary to Parkinson's disease, it's secondary to Alzheimer's disease, it's secondary to Huntington's chorea, multi-infarct dementia. By the time you get towards the end, the patient looks all the same. Prior to that, there'll be some characteristic differences that you can many times pick up and identify to say this is the type of dementia the person has. But towards the end, it's just about the same. And we really only have, we don't have great treatment for any of the dementias. We have okay treatment for Alzheimer's disease. We have some treatment for Parkinson's disease. Multi-infarct dementia, not the greatest. Huntington's chorea, not the greatest. So a lot of times, just not the greatest. Now, when a person gets dementia, they can get dementia from several different reasons. And cancer, if they had a brain met, they could get that will show up and appear to look like dementia, which is totally different from Alzheimer's disease. And there are other things that can mimic dementia as well. If a person is significantly depressed, that can mimic dementia. But you can distinguish it usually because the person that is very depressed, even though they may not want to come up with the answers, they can if you push them. If you push them to come up with the answers you're trying to get out of them. Where the demented person, it doesn't matter, or not, well, I'm largely speaking of Alzheimer's disease, so I use the word dementia and Alzheimer's disease interchangeably in this conversation, but they're not really interchangeable because there are other types of dementia. But back to Alzheimer's disease, when you have a person that has Alzheimer's disease, it doesn't matter how much you push them, they are not going to be able to come up with the answer, particularly if it's short-term memory, where the person with depression may be able to. Other things that may mimic a dementia may be medication interaction, maybe too much medication, not enough medication. If they have a metabolic problem, could mimic dementia. If they have some type of brain tumor, could mimic dementia or mimic Alzheimer's disease. So there are some things out there that can mimic Alzheimer's disease. We can usually make a distinction once we do a few testing and so forth to distinguish Alzheimer's disease from the other things like being behind on your fluids or depression, things like that. But when it gets down to it, it may be very hard to distinguish one type of dementia from another. But other metabolic problems, say they have a thyroid problem, things like that, we can usually figure that out with blood work and things like that. So I'll continue this next time. Dr. Ferguson coming to you from the Passion Cam, talking about Alzheimer's disease.